So that's kind of the message for rhinoplasty. Make sure you have a credentialed surgeon and someone who you're going to trust through the process, because rhinoplasty is absolutely a process. Hi, everyone. Welcome to Lipstick and Lipo, your unfiltered guide to plastic surgery. I'm board-certified plastic surgeon, Dr. Ashley Amalfi, joined with my dear friend, board-certified plastic surgeon, Dr. Smita Ramanathan, down in Jersey. I'm up in Rochester. She's down in Jersey. But we're here for you guys, and we are excited to be answering your top Google searches, right? So we're kind of going down the list.
Yes, I love this. I love that we're doing this.
It's fun and it's like exactly what you want to know, which is why we're here. And we always want, we love your comments when you give little comments and feedback about what to do next. We really appreciate it. So it helps us educate you, which is our goal. So the next question on our list is about rhinoplasty, and I want to address those concerns. So, the first question was like, what do I need to know about a rhinoplasty? And then the second part of that is, tell me more about recovery. So Smita, you want to start?
Yeah, so I think with rhinoplasty, and this sort of, is true for any procedure, but more so with rhinoplasty, just because it is the center of the face. It's a very small area. So it's really important when you are thinking about rhinoplasty and you're, researching and doing all of that stuff to sort of take a step back and kind of figure out what it is that you specifically want changed with your nose, right? Is it a breathing issue? Is it the tip of the nose? Is it your profile? You want to be really specific when you go in to see your board certified plastic surgeon or your facial plastic surgeon, so that you can communicate effectively with them and they can then let you know, if those changes are reasonable to make and can safely be made. So I think that's the most important thing, really, is just knowing what you want to change or see improvement in.
Yeah, and those two pieces, the functional component, like what are the functional things that you want fixed, and then the aesthetic component, what do you want to look differently? And then the second part of this question from all of you is, what to expect from recovery. So this is a long-term recovery, right? And the hardest thing, like Smita said, this is the center of your face. So you can't hide it. Like when you have a breast aug or a tummy tuck, you can't like do this in sweater season and no one's going to notice. So you have to kind of plan, right? First, you have to plan for recovery.
I know you can't hide it.
You can't hide it. So in the beginning, you're going to have a cast and a splint and nasal packing, and you can have black eyes. And when you have darker skin, sometimes those black eyes kind of stick around a little longer, just like bruising stays residual when you have darker skin. So that first like 2 to 4 weeks is one where you might not want to be in the public eye as often. And then recovery is long because it stays swollen. It's a very sensitive area and little areas stay very swollen. So it's really like a full year before you can appreciate what that final result, that final fine-tuned refinement is going to look like, right?
Yeah, absolutely. I think the swelling, and that, that also depends on your skin quality, which your surgeon will talk you through during your consultation and obviously during your recovery. But, a rhinoplasty is a surgery of millimeters, right? It's not like a big tummy tuck or a breast augmentation or reduction where the results are more dramatic. And so a little bit of residual swelling, you're not really going to notice on the breast, but on your nose, you will, right? Because that will really alter the changes that you see in the results you see. So I would say the most important thing about recovery, that it is longer just because things are more noticeable and you can't hide it, like you said. But you have to be really patient with it and sort of trust the process, because it is normal to sort of, 3 months be like, expecting final results, and you're not going to see it at 3 months.
It can be frustrating. So be patient. Make sure you have a surgeon that you trust, board certified plastic surgeon, board certified facial plastic surgeon. And this is one where you really want to trust your doctor, because you're going to be coming in a lot for follow-ups and you guys are going to be talking about things, and you need to trust the process. So that's kind of the message for rhinoplasty. Make sure you have a credentialed surgeon and someone who you're going to trust through the process, because rhinoplasty is absolutely a process.
Yeah, it is a process, but it's a good one. So you just have to take the right steps, like you said.
Incredible results.
Yes, absolutely. It really can make big differences. So, all right, guys, this was an awesome episode. We're going to see you next week. We have a lot more questions to go through, so make sure you guys subscribe.
All right, see you soon.